The demand for family doctors in our province is growing, something that walk-in clinics in BC can't ignore. They're launching a petition to call on the government to help ease the demand. For more on this, we're joined by Mike McLoughlin. He's the director of the Walk-in Clinics of BC Association. How are you doing today, Mike?
Good, Jay.
Thanks for joining us. Talk a little bit about what you've seen in the last few years in terms of the number of people using walk-in clinics.
Yeah, so we've seen quite an increase in the number of people at walk-in clinics. In fact, now in front of our walk-in clinic in Kelowna, we have 15 to 20 patients lined up every day in the morning before the clinic opens. And these lineups are happening all across the province.
And why is that? Why is this? What's causing this?
Well, it's because of the lack of physicians. Because we used to be able to staff the clinic with 2 physicians, but now we can only staff it with 1 physician. And there's a limit to the number of patients that 1 physician can see in a day. It's a volume limit. And so what that means is that people want to be sure they get on the list to be seen, so they come early and they line up.
What is behind this volume cap? Why has that been put into place for the doctors?
It was put into place about 20 years ago with under the NDP government, and it was there because they wanted the college and the Society of General Practice wanted physicians to spend a reasonable amount of time with the patients, and that's understandable. But now with the physician shortage, there's a lot of clinics that are closing early because they only have 1 physician and they can only see a certain number during the day. And really, they should be able to see more patients in a day.
Now, why are so many British Columbians looking for a family doctor? Or are they not able to get one?
Yeah, that's just it. I mean, there's a shortage of doctors, and I know it's been said that there's more doctors in BC than there's ever been, but really, is that sufficient for the demand? Doctors are working with chronic disease and complex care patients, and it means that their panel size is a lot smaller. So that basically means that there's less doctor capacity for patients, and a lot of patients don't have a family doctor, so they end up at the walk-in clinic.
And there's been a problem with walk-in clinics closing, quite a few of them in recent years. Mike, talk a little bit about the numbers there and how it's impacting everybody.
Yeah, so there's 45 clinics have closed in the last 5 years. I was out at the Seafair Medical Clinic in Richmond last Friday, and they closed their doors. They've been in business for 25 years in Richmond, and now they're out of business. Some clinics are family practice and walk-in, and they just couldn't manage the volume of walk-in walk-in patients, so they close and they just stay as a family practice. So all told, 45 clinics have basically shut their doors to walk-in patients. So this is putting a big strain on the system, and you'll see emergency department people in the emergency department that don't need to be there because they could be looked after at a walk-in clinic.
I want to circle back to something you said at the start of the interview. 2 doctors were able to work at walk-in clinics. Now that's down to 1. Is that what you said?
Well, yeah. Basically, there's not enough doctors to staff the schedule. So the clinics are only putting on 1 doctor during a day, and of course, there's more patients than that doctor can see in terms of the volume limit. And now some doctors will see those patients even though they're getting paid 50%. Or even after 65 patients, they don't get paid at all. But it just doesn't make sense to stay in business if you're providing services for free. So this is the challenge. We need more family doctors in British Columbia, and we need to recruit more doctors. We need to train more doctors, and we need to retain the existing complement of family doctors.
So what does the government need to do to ease the demand here, Mike?
So some of the things that they could do right now is they could increase the number of residency positions for family practice, and that would attract more doctors from, say, overseas that are looking to move to Canada. There are a lot of Canadian-born doctors that were trained overseas and that would like to come back and work in Canada, but there aren't enough residency positions, so that's certainly something that they could do. They could also increase the number of medical students and encourage those students to specialize in family practice. Because right now, a lot of those students are interested in the specialties because specialties earn more money.
Has there been any steps taken towards helping find a solution for the problem here?
Yes, there has. The Divisions of Family Practice is a program that's put together by the GPSC and the GP for Me program. And they have these divisions in all the different areas of the province. And they're doing a good job recruiting family doctors. There's the Health Match BC website. But the challenge is there's just more demand than there is supply. So right now in Health Match BC, there's 447 vacancies. Last year, we had a net increase of 151 doctors. So we're short 290 vacancy. Those are sitting empty right now. And that problem is just growing. So we need to focus on this, and it needs to be part of the election campaign. Each of the parties need to have in their election platform a statement regarding family doctors and the supply of family doctors and how they're going to deliver primary care to the citizens of British Columbia.
Let's talk a little more about the petition you're launching. When will it be up, and how can people get involved?
Okay, well, it's up right now. If you want to sign the petitions at bcwalkinclinics.org, and it's going to be formally launched on Friday at our annual conference for walk-in clinics. So we're going to present that to the public. It basically is calling on more family doctors. It's calling on elimination of red tape, such as the daily volume limits. And it's also calling on the Ministry of Health to put primary care closer to home, closer to people in their neighborhoods and in their communities. So people